the founder and now the executive director and the COO. He's got all kinds of titles. CFO, COO, CEO of Liberty HealthShare. Now, Liberty HealthShare, that is my health insurance company. I've been with Liberty HealthShare, I don't know, and how long have we been them now? 6 years, right? 6 years with them. And ever since Obamacare crushed us, where we had to pay $1,000 premium a month and we had a $10,000 deductible, so we didn't have insurance, and we found Liberty HealthShare. They've been a godsend to our family because it's not traditional health insurance. It got us out of the whole healthcare Obama rat race. And founder and chairman Dale Bellis with us now of Liberty HealthShare. More information, 855-585-4237, or do it the easy way. Go to libertyhealthshare.org. Dale, good to have you with us.
John, it's a pleasure to be with you, my friend, the Godzilla.
Thank you, Dale. Hey, you know what? Ann and I, my wife Ann is with me in D.C., and this is so amazing. We were driving up here yesterday from our home in Virginia Beach. Ann's got to spend a couple of days up here with me. Lucky her. And we were just, talking in the car, as you do. We had about a 3-hour drive about some of the things we got coming up and checkups we have to have. And she has to go to the doctor. And she was saying, yeah, I'm going to schedule my checkup. I got to get my annual checkup, the mammogram and all that stuff. And she says, the great thing about it is with Liberty, I don't have to do anything but call up and schedule the appointment. That's it, because now they know who I am. It's all paid for. I get my annual checkup. I don't have to do anything. There's no paperwork involved. It's about the easiest thing I've ever done. And she says to me, coming up here, she said, what a godsend Liberty HealthShare has been for us and our family, Dale. I just wanted to share that. That just happened a day ago.
That is so meaningful to me, John. Thank you for sharing that. In fact, I'm joining you in Washington, D.C. tomorrow morning. I'm attending a seminar put on by the American Enterprise Institute, a great conservative think tank, but they've invited the director of Health and Human Services, Mr. Azar, to come and present. The title of the seminar is Fixing Healthcare. Now, that is obvious that, number one, the ACA has broken healthcare. But
Disaster.
Most importantly, John, and this is what the story you just shared is indicative of this, that healthcare is broken other places otherwise because health insurance has broken or has destroyed healthcare. Their overarching intrusion in people's lives, the standards they follow by the way in which the kinds of care that we can access, the fact that they manage our money. We send our money away to a third party. They're the ones paying the bill. There's no incentive on the part of the individual to control costs. Instead, you and I and 100,000 other households have dropped out of that system and instead joined together in a like-minded community. We're all self-pay patients. It's our money at stake. We're 100,000 households who are watching out over our costs because it's our money and the money out of the pockets of our fellow members. That changes the entire mentality, and that's my message to them, John, that healthcare is broken, and we need to simply put it back into the hands of the individual customer so that we can exercise our healthcare freedom.
That is so spot on, and I'm so glad you're coming to Washington tomorrow for this think tank discussion, Dale, and you're really going to enjoy meeting HHS Secretary Azar. I had a chance to see him at the White House press briefing. I think it was on Friday. I don't remember. It was one day last week, and he was outlining the president's new initiative to bring down the cost of drug prices. And, he was a drug company executive. So
he was.
Yeah, he kind of knows what he's talking about. I had 3 takes from that. The first take is he's really good, and I could see why he was a senior executive of a big company, because he was really, really great at the press conference. Secondly, he was sharing with us all the reasons why the drug companies and that whole business is broken and how they have all these scams going on. And we was talking about list price. And he says, they have a list price And the higher the prices, the more money that everybody makes. So they just keep jacking the price up, and then they give you a 30% discount or a 20% discount. But it's not a discount at all because they've already jacked it up 35%. And so he was saying that the whole thing is a scam. Now, he was in the business, so he was part of it. And that carries over to healthcare because you got all these shenanigans going on. Nobody ever knows what you're paying for anything. Because if you're paying $10, it's $10. You don't know what the cost is. And the whole thing is a complete mess. The other day we were talking to somebody who had the insurance, regular insurance through a big company, and their son plays baseball with us, and his arm hurt. And, just pitched 3.5 innings, and his arm hurt for a couple days. Okay, so my son pitches a couple times a week. Sometimes his arm's a little sore. Work out, put ice on it. Give him some Advil, check it out. If it's in the muscle, it's fine. I pitched, I get it. But she took him to the doctor. And I'm telling you, she took him to the doctor because it was $10, right? It's like, why do you have to take your son to the doctor? He's pitched, 72 pitches. His arm is going to hurt at 13, right? But that's the decisions made. It's only going to cost me $10, so who cares? I've got to look at it differently.
If somebody else is paying the bill,
who cares?
There's no motivation on the part of the consumer to control their spending habits, their consumption, etc. If I'm going to go buy a car, and John, you're gracious, and you're going to pay for it, you say, Dale, go buy yourself a car. The likelihood is I'm not going to go to the used car lot. I'm going to go to the Lexus car lot because somebody else is paying for it.
Of course.
That's what happens in America's health care. There is a disruption. In fact, most people never see a bill. They're insulated from the costs, and that's the major flaw in health care today.
I tell you what, and there are so many people skeptical of this. And whenever I've got you on, I'll get texts from people, and they'll be like, well, how do I know if I get cancer, they're going to pay for it? And, some article I read said that one of the other MediShare or something, that company's not solvent and there's not enough money in reserve. Dale, why don't you just address that now?
I will, because it is member-to-member cost sharing. We don't collect the money from the members and hold it. We're not a third-party payer. Every month, you and I and everyone else participating sees their money in their own individual online account, and transparently, it's assigned to another member. So you literally see your money flow from your account to theirs. And a sufficient number of members are assigned to each one of those expenses. We cut the check out of the member's account and pay the doctors and hospitals. So total transparency, total openness, nothing hidden. It doesn't drop into a company black hole someplace. And I believe that kind of transparency and disclosure is what maintains not only our individual confidence, but the confidence of the entire nation looking on our particular system. That's number one. But number two is we're sharing in the actual cost of health care, not an inflated projection like premiums do. Whenever you and I have a bill, it's discounted to the best cash price. We're sharing in those actual costs, and so it's post-assessment. Whatever currently occurs, that's what we share in. And if our share amount, which has not changed, frankly, in the last 3 years, we're all subject to inflation, medical inflation, and so eventually we'll have an increase, I'm certain, in our share amount, but that amount is what's adequate to meet all the bills submitted by the members every month. So ours is a totally different methodology and paradigm, and that's why it works. It's our money at stake.
No question about it. With Dale Bellis, Liberty HealthShare founder and chairman. Dale, traditional health insurance is going by the way of the beeper. I don't think if anybody gets involved in getting out of the health insurance system. Now, look, if you work for the federal or state government or the county government and you're getting, the Cadillac coverage and you're paying $10, yeah, I get it, right? Stay on that. But if you're on your own and you have to get your own insurance, or you're with a small company where, they provide something, but the majority of it is on yourself, or you're a small business owner, or you work in the gig economy on a 1099, you have to provide your own insurance for your family, the best option out there, I'm telling you, is Liberty HealthShare. It's been tremendous for my family. And I love the fact that when I send my share amount in every month, which I think, Dale, is like $580 or something like that, I have to pay. Can I say this? I have to pay the tax because I'm overweight. And if I lost weight, then I'd pay less money. I mean, but look, that's honest, right? It's like, okay, you're too heavy. You got to pay more, lose 30 pounds, and you pay less. I mean, that's just reality of the market, right?
That is really our motivation to obviously pay attention to your health and help you get to those goals that support your health. That's what we're after. We're after caring for our individual health and being health conscious.
No more donuts for me, Dale. That's the problem. No more of those Dunkin' Donuts or Krispy Kreme, whatever. But I love the fact that every month when I pay it, I see exactly where it's going. So it's like freeing. It's like you get rid of the ball and chain, and you're free. And there is really a sense with the Liberty HealthShare deal, there's really a sense of empowerment that you feel that you've taken control of your health care for your family, you're sharing it with others, and it's a whole uplifting experience rather than, as you say, sending that premium to the black hole, which and who knows what happens after that. And then they fight you on every claim. I mean, who needs that, right?
No one needs that, and in fact, my encouragement to our policymakers in Washington, and you're exactly right. Right now, you and I, as individuals in the marketplace, can participate with Liberty HealthShare, and those who are still captured by the system, particular employer-sponsored plans, don't have many options. I believe the answer to that, though, is to change the flow of dollars, John, so that it rests in the hands of the individual employee. Make it a defined contribution, not a benefit from my employer, but a contribution to my account from my employer. That allows me the choice and the freedom to make those decisions for myself and my family, and we just need to simply see that change so that it would alter the entire healthcare marketplace overnight if the dollars were in the hands of the individual consumer.
Dale Bellis coming to Washington tomorrow to help change healthcare in America for good. I love it. Look, Liberty HealthShare is all you have to do. Go to libertyhealthshare.org, libertyhealthshare.org. Give them a call, 855-585-4237, 855-585-4237. Here's the coolest thing. Get a quote. That's all you have to do. Go to libertyhealthshare.org. Say, hey, of course, the most important thing ever when you go to libertyhealthshare.org or you call them, the most important thing to say, Dale, is, hey, I heard this on the John Frederick Show. That's the most important thing to say. Now, after you say that, you ask for a quote. And you just give them the information, and they will come back and they will say, here's what it is, and they have to understand it a little bit. But when I did that and I got my quote, I didn't get it. My wife did it. She told me what it was. I said, well, that's a mistake. You didn't put in 3 people. You either left me out or Joseph out, or you didn't fill the form out right, because it can't be that. It's got to be higher than that. She's like, no, I did. This is it. And we've been so happy with it. I'm a walking, talking testimonial for Liberty HealthShare, 855-585-4237. Go to libertyhealthshare.org. That's libertyhealthshare.org. Get more information. Dale, thanks for being with us.
What a pleasure. Thank you for the invitation. God bless.